So Penina, are you able to see me from where you are? So...
Yes, thanks, Shireen. I can see you.
Perfect. Right, we're just waiting for everyone to come in from the virtual waiting room, and I think we are good to go. So, hello everyone, and thank you very much for joining us today. My name is Shireen John, and I work in the communications team here at LIDC, and at the back of the room is the manager, Gun Benjaminson. So she's going to be helping me, us today. Very happy to see you all, very honoured and happy to have LSHTM Centre on Climate Change and Planetary Health leading the discussion today once they've done their presentations. So for those of you who don't know very much about LIDC, we are an interdisciplinary organisation. I have such a problem with the term development because I just think it's so loaded, but we have to come up with another word, working towards equality and justice rather than trying to develop people, but we call it development. So yeah, that's what we do. So if you're in one of our member institutions, of which there are a number, I'm not going to list them all, please go on our website and take a look, then membership is free, but you have to actually sign up. It doesn't just sort of land in your body. Do check our website for blogs, podcasts, events. If you have ideas for us or you want to submit something, again, do that through our website. We'd be very happy to have you. So a few words about today's event, which obviously could not be more topical given the weather that we've been having here in London. For too long, we have lived in a world where the global north has created environmental damage, the consequences of which are borne by people in the majority world. But as is the way with most crimes, you can only get away with it for so long. It is one planet, and now the global north is starting to feel the consequences of those catastrophes as well. I wrote down the tide is turning. And yes, I guess in a way it is. Not that we are happy to see increased incidences of floods, fire and so on, which are the consequences of climate damage. But we're going to be exploring that today with the experts. So as I said a few moments ago, we're very delighted, very honoured to have our colleagues here with us from LSHTM Centre on Climate Change and Planetary Health. Just a few words about the format. Normally when we do in-person events, which it's been a long time since we have been doing, so yay, we're back. We would ask people to keep their phones off. But then how are you going to live tweet if you have your phones off? So yeah, feel free to go ahead and live tweet. We are at lidc._UK. And if you look at our recent posts, you will see the Twitter handles for our colleagues as well. Toilets, one floor down and turn right, and then a couple of floors up. We have not planned for there to be a fire alarm. So if the alarm does go off, then we have to exit through the door there, cross the road to in front of the square. After the presentations from Dr. Anna Bonnell and Dr. Penina Murage, we are going to have a conversation which will be moderated by Dr. Sari Kovats. Gun and I will be having a look at what's happening online and letting the panel know. So you will see some movement between that desk and this. Do not be disturbed. It's all part of our plan. We aim to finish at 2:15. We would love it if you could let us have your thoughts, contributions, feedback on what's been shared here today. So with no further ado, and with very great pleasure, I'm going to hand you directly over to Dr. Sari Kovats. Thank you.
Thanks very much. Welcome everybody. It's nice to see everybody in person as well. The last time I gave an in-person talk, there were 2 people in the room. So this is practically a full house. I'm just going to say a couple of words about how we're going to run the session today. So our speakers are going to talk for about 25 minutes each, and then we'll take just questions and clarifications. If you've got some kind of burning wider issue question, maybe save it for the panel discussion that will follow after, and then we can have a nice debate about what we could be doing, what we should be doing, what the issues about why we're not doing more, that sort of thing. Okay, but then we're going to hand straight over to Anna Bernal, who's going to talk to you about the impacts on maternal health.
Thank you. Good afternoon. Welcome to in-person and online colleagues. It's great to be here with you today, and I will be talking about the impact of heat on us, and then I will be passing over to Penny, who's going to focus more on solutions and options going forward to help adapt and mitigate. So just some background to start with. I can get the slideshow to work. Which I can't. Ah, here we go. Okay, great. So the IPCC states that the human influence has warmed the climate at a rate that is unprecedented, and that you can see that the observed observations are tracking very nicely along the simulated observations, showing that unfortunately the models are all doing their job and telling us what's actually happening, and that we are in fact heading towards the climate catastrophe that we see predicted for the last 40 years. The bottom line gives you what would be happening without human influence, and there you can see that global temperatures would just be continuing along. And we know, for those who are in the UK anyway, that we have really experienced earlier this week, we experienced an extreme heat event, which I don't know about you, but very much was a bit of a shock to the system. But this is very much not an isolated event. Only 2 months ago, there was a huge amount of extreme heat felt in India and Pakistan for more than a month. And last year, there was the heat dome effect across North America, with associated deaths and wildfires. So really, this is absolutely occurring across the world and is a global problem. Just before I go into the details of what that then means to our health, I just want to put it into the context. So this talk, I will fight back a bit against the political rhetoric that is often heard around, so what, it's hot, we can deal with it. We go to hot countries on holiday, what's the big deal? So I'm going to talk through some of the detailed physiology about what happens when you're in an extreme heat event and how that can affect you, even young, fit, healthy adults, and why it's dangerous. But before I do that, I want to just place it within the wider picture of the impacts of climate change on human health. So although this focus of this hour is going to be really on extreme heat and the effects of extreme heat, it is not happening in isolation. So along with the extreme heat, with the rising temperatures, there's much more increased chance of extreme weather events, be that floods or hurricanes, which then have impacts on injuries and fatalities. We know that asthma, cardiovascular disease are all increasing due to air pollution. And this is also only a fraction of the problems that we see in a broader picture of environmental health, where we consider things such as biodiversity loss and the ecological breakdown, which will then have much broader effects on human health. Moving back to heat, I will focus really on the fact that the climate crisis is a health crisis. So this is work that's done by our colleagues in London School. This is real-time estimations of the impact of the last 2 days of extreme heat in the UK. And they estimate from the models that an excess 844 people died in those 2 days because of that extreme heat, who wouldn't have otherwise died. So that's a very kind of local and personal example to us in the UK, but this is not a problem only for us. In the heat wave of 2003, an estimated 70,000 excess deaths occurred across Europe. And if we think again more globally, you can see that this mortality and so this increased death with heat occurs across the world. So this is a study looking at 16 different locations where you can see that as the temperature increases, you get an increased risk of death. But it's not only about increased mortality and increased death rates. There's plenty of other health impacts that are associated with extreme heat. We know that chronic kidney disease is on the increase, especially in occupational workers, increased risk of diarrhea and waterborne diseases when you have the combination of extreme heat with water scarcity. There's an increased risk of injury and mental health admissions to hospitals. And this emergency room visits increases by up to 10% during a heat wave event. And that then puts extra pressure on the healthcare services. And even if you're there not for a heat emergency, you will find that the healthcare is under extreme pressure at the moment. We will go on to talk about the pregnancy outcomes in more detail later, but it's linked to a large number of adverse pregnancy outcomes. And there's been recent work showing that heat exposure in schools is also associated with poorer exam scores and poorer outcomes in later life as well. And finally, something which has receiving more attention is the fact that occupational workers are very impacted by heat, which then affects not only their health, but their ability to produce the goods that we are using. And so there's evidence that as you work in the heat, your work capacity reduces and we will be unable to produce what we expect. So just to touch on the at-risk groups, as I say, outdoor workers are a risk group, in particular the elderly and infants, athletes, pregnant women, and anyone with chronic medical or mental health conditions. And I will explain why those people are at extreme risk by bringing us back to understand what's happening in our bodies when we're exposed to heat. So at the top of the screen, you can see the heat balance, which is, we are a warm-blooded mammals, so we maintain our core temperature very closely around 37 degrees Celsius. And we do that by balancing the heat gain with the heat loss. So our heat gain is from our external conditions, but also from our metabolic heat. And we lose heat by the kind of ways that you lose heat, so evaporation or radiation. And then we have two main ways in which we can adapt to a heat environment. We can either change our behavior or we can respond physiologically. So in our behavioral changes, we have a lot of capacity, you would think, to change our behavior. But if you work outside, for example, then you don't have that option of avoiding the heat. If you live in a house which is not well insulated, or it's within a very concrete lack of green space area, then actually it's very difficult, as we all found a few days ago, to avoid the heat, in which case the behavioral options are limited. And the physiological impacts that we have are also finite. Is it possible to minimize that? Sorry, so that everyone just can see the full.
Just move it up. Just move it up.
Oh, there we go. Okay, great. So if you focus on the top half, this is talking about thermoregulation, so how your body controls heat. The top half is what happens when you're hot, and the bottom half is when you're cold. So we want to maintain the steady state. If we start to go up, we send a signal, our core temperature goes up, we send a signal to the brain, and the brain has two options. It diverts blood to the skin and it starts you sweating. So those two things occur simultaneously. And the blood flow moves from your internal organs to the skin to allow radiation of heat. We all know that your skin gets very hot when you are in a heat stressed environment. This schematic gives you an indication of what can happen if you're in a heat stress environment and you stay in that heat stress environment, and to the point that you start to develop heat illness and go on to develop heat stroke. So what you can see here, if we start here, is that you get this peripheral vasodilation to start with. So you get the blood flow going to the skin. That then causes a decrease in your blood pressure, and your heart has to compensate that by beating faster. And that can then cause cardiovascular strain. And that's why those people who have existing cardiac or respiratory problems or are elderly are at risk of problems with heat. When you sweat, you get obviously a fluid loss, and if you are unable to replace that, that can then feed on to causing problems for your kidneys and dehydration, and lead into cardiovascular strain as well. And then another thing that maybe people are less aware of is that this big diversion of blood to the skin can actually reduce the blood flow to your internal organs. And that can actually be very dangerous, because you reduce the blood flow to your gut, and that allows leakage from within your gut, activation of the big kind of dangerous cytokines, and lead to end organ damage. So that's what's happening. That's why people are saying that extreme heat is a risk factor to your health. And if you think about the risk groups that I mentioned, for example, this very small infants have much less ability, they have much less sweat glands, so they're less able to sweat, they're less able to lose the heat compared to adults. It's impossible to talk about extreme heat without bringing into consideration the equality and inequality in the impacts of climate change, as Shireen has already mentioned. Although we are have currently suffered with an event going forward, and currently we know that the most affected regions are the tropical regions, and those regions that have contributed the least to the ongoing problem. And this is projected heat wave days under different climate scenarios for Africa. And we are currently on target to exceed the 3 degrees by 2100. So you can see that there is a lot of heat that will be experienced in regions that have contributed almost nothing to the problem. So now I'm going to focus on pregnancy, because that's my area of particular interest, and talk through some of the impacts on pregnancy and also some of our work based in West Africa. So this is a review of work that's focused on the USA, where they looked at different studies based only in America and showed that heat was linked to both preterm birth, low birth weight, and stillbirth. And this is work done by Dr. Kovacs and colleagues, looking at a much more global synthesis of evidence, and again found very clear evidence of increased risk of preterm birth and low birth and stillbirth during different heat metrics. There are more recent studies looking at at-risk groups. So, for example, this is some work done from California, which identified that younger mothers were at higher risk of the impacts. The same group has also found differences in both ethnicity and socioeconomic risks. The USA is a slightly special case because of the access to healthcare, so it's unclear whether this is due to any kind of hard biology or whether there's other factors at play in that. So I'm going to talk about our work in West Africa because those studies that I have just presented are mainly from the global north. So they're from Europe, America, Australia, and there's very little evidence currently out of sub-Saharan Africa and tropical regions around the impact of heat in pregnancy. So we focused in the Gambia, in West Africa, and in Kenaba, which is a rural area, a couple of hours inland from the coast. And we picked this region because they are already experiencing high levels of heat stress. So the wet bulb globe temperature is a composite of heat and humidity. It gives you an indication of how hot it feels to you. And as you can see on the left-hand side of the screen, they're currently already sort of going up to almost 29, but it's predicted going forwards to reach 33 wet bulb globe, which is extremely hot. And why do we particularly choose pregnant subsistence farmers? These are a neglected population. They are at high risk because they are pregnant, so they're in the risk group. They work outside during pregnancy, and they are in this kind of band of high risk exposure. And they have perhaps less choices in terms of avoiding the heat than maybe other populations. So we had a look at what their current exposure is and what the levels are by measuring with our portable devices what they're actually already experiencing on the ground. And then we looked at both their health, so how it was impacting on them, but also how it was impacting on the baby by measuring the umbilical artery Doppler. So this is a way of looking at how well the placenta is functioning. The placenta is obviously vital for survival of the baby. It's where all of the nutrients and oxygen and everything is fed to the baby. And the Doppler gives you an indication of how well that's working. So this is what the tracing looked like. You can see if you get the green, then everything's fine. Orange, not so fine, and red, definitely not fine. So we used this as an indication of what was happening for the baby. And if we couldn't use this scan, then we used fetal heart rate as an alternative. So what did we find? Well, they're already being exposed to very high temperatures on the ground. So wet bulb globe is divided by categories and is used by occupational settings to tell you how much a worker can work per hour, whether they should rest. So once you reach category 4 and 5, you're supposed to rest 75% of the time. So this is what their daily reality is. This was nothing special. This is what was happening. And this is just a slightly different metric that is also used. This is called the Universal Thermal Comfort Index, which again kind of is a composite measure. And using that metric, we found not a single day where there was no heat stress experienced on the ground. And just to put the context of our results into place, you may think that, oh, well, these people are out farming, they're working really hard. But actually, when we looked at the energy expenditure that they were doing equivalent of a brisk walk. So something that's, we are actually advised, when you're pregnant, you're advised to do as health, for your own health in pregnancy. And we found that the maternal temperatures, both skin and tympanic temperatures, increased significantly from background to working. So the women themselves did develop heat strain. And when we looked at how that then impacted on the fetus, again, we saw a significant rise in the fetal heart rates. And out of our 122 field visits, 41% of them experienced an episode of fetal stress during the field visit. So that was sort of like the headline findings of this pilot work, where we really didn't know what we were going to find or whether we were going to find this. We've also explored what was the lived experience of the women whilst they're there working, and what we've, sorry, just moving that. So we asked broadly around what's the impact of climate change has been for them, and they found that yield and crops have reduced. So that's actually primarily their main concern, was around the ability to feed their families. And this is related partly to depletion of the soil, salt intrusion, which is also a consequence of climate change, but also to do with a reduction in the rains from climate change. They acknowledge, they described that it's very difficult when they're pregnant and having to work, that they felt like their body is burning and that they need to take it easy because they get very tired and dizzy. And then in terms of what solutions they had, what adaptations they were performing already, they know to take a rest, they know to do the sort of basic things, work, rest, shade. So they work a bit and they rest in the shade and they drink. And then when they feel better, they'll go back to work. But they cannot not work because life would be too difficult. So in summary, this is a global problem. It's affecting everybody, but much more so across the tropical regions. The climate crisis most definitely is a health crisis, and we see this increased risk of death in the at-risk groups, but there are many other health impacts that should also be considered. And when we talk about the impact of heat, we must also acknowledge that the inequality in the effects and climate justice must be central to our actions going forward. So just before I finish, and it sounds like a summary, I've got a few more tiny points before I hand over to Penny. So this is just to talk about where we're going in terms of climate change. So carbon dioxide levels, as we probably all know, almost every day it feels like break a record for reaching the highest ever recorded. We are currently at the same level of carbon dioxide as was seen 3 million years ago. Over 30% of the heat-related deaths can be attributed to human-induced climate change. So without human-induced climate change, 30% of those deaths would not have occurred. And this is the latest from IPCC, where you can see that the likely range of us heading current emission scenarios is to reach 4 degrees by 2100. But it's not all doom and gloom. Penny is going to talk a lot about some really great solutions, but I would also like to highlight the fact that the IPCC Working Group 3 has done an incredible amount of work, and there is a huge amount of dedicated, fantastic people out there working on solutions, and it's more about enacting them than finding them. So finally, although the climate crisis is the greatest threat, perhaps it's an opportunity for us to re-envisage the future where there's hope for everybody. Thank you very much.
Thank you, Anna. Any questions? And for people listening online, please put your question in the Q&A and then we'll be filtered through. So any questions in the room? Any questions about that? Yes.
I was just interested, are there any plans to do any follow-up work on why younger mothers would be particularly impacted? Because normally you think that, I don't know how young you mean by young.
That study was under 20. We do look at the age. So for our work directly, we were looking to put age into the model. We didn't find any evidence in our group of age being a risk factor, but certainly it's included in studies going forwards.
Yes. Might that be because younger people maybe need healthcare in the US?
I honestly don't know, but we did see, certainly we saw some young mothers put their temperature up in our study without realizing it, so without even noticing the effects on themselves, and were quite surprised when we said, oh, your temperature's gone up above 38, we need to cool you down. So I don't know whether it's physiologically they're more able to deal with the heat, so they don't notice the impacts as much, and it doesn't, but it's still having an impact on the baby, or it's to do with the inequalities within the health system, or it's a combination of both. Yeah, so I think there's still quite a lot of unanswered questions on that.
Question, any? Julian?
Thank you very much. It's been an interesting study from Africa. I'm kind of sorry that because I have grown up and worked there most of my time. And the last sentence actually was part of what I wanted to ask, because I woke up and dug in the sun for about 4 or 5 hours. And if you ask the people on the ground what knowledge they have to build this, yes, they will tell you they know the kinds of times when the sun is very hot. So from your study, is there any times of the day that you were able to establish and help the people to say, okay, around this time, I think you need to organize work? Did you find out that kind of time?
Absolutely. I think it's a really good point. And I think there's a lot of local knowledge, as you say, about the best ways of organizing their time so that they can avoid the heat. But to balance that, there are social and cultural pressures which prevents the women from working at the best time. So often they would say to us that they would like to work either early morning or late evening, but they have to first prepare breakfast for everybody or do whatever it is that they need to do around the compound or cook in the evening. So then the time slot is much more limited than you would think. So I think changing the working timing is an option, but maybe not as simple as it sounds and not quite as straightforward as you would think. And there's also some evidence from other settings where you change the time and then women are at more risk of violence because they're out at early times where there's less people around. So yeah, it's complicated.
Okay, just to follow on just a little bit, I think that's okay. When I look at it, we're not even directly just for them working on the field, but there is the environment. Let's say I'm going to cook, the kind of kitchen I'm cooking in, the kind of fuel I'm using to cook is also another source of heat.
Absolutely.
So yes, I just want to ask the question, like, where did your heat kind of studies go back? Just outside, without the inside?
So this work was really focused kind of on occupational heat because we were focused really on what was happening for the subsistence farmers. We actually have a project going forward where we're going to explore the use of solar cookers as an alternative option to kind of avoid that heat of the cooking area. So yeah, it'll be great to chat to you about that afterwards.
Are there any online questions? We could take one. No. Okay. All right then. Thanks so much, Anna. We're going to hand over to Penny, who's online, just in the UK. Who's going to talk about nature-based solutions. Penny, over to you.
Yeah, thank you so much. Can you hear me?
Yes.
Yeah, thank you so much, Anna. That was a really great summary of the health effects and a lot of food for thought. I think the recent heat wave in the UK has been a wake-up call for everybody. So I mean, I consider myself a healthy adult, and I was completely incapable of doing any meaningful work there, particularly on Monday and Tuesday. All right, so today I'll be offering some ideas on how we can harness the natural environment in order to help us adapt to climate change. I won't be talking about mitigation, but the natural environment also has mitigation potentials. And I'll be focusing this on outdoor agricultural workers in low-income settings in Tanzania. So I think everybody here agrees that things are warming up very quickly. But in case anyone doubts that, you'll find these images from NASA very convincing. So it's a special comparison of the 1976 heat wave, so on the left-hand side, with what we witnessed this year. So on the right-hand side. And I think the message here is not that it's not only that heat waves will increase in intensity. So for example, the highest recorded temperature back then was 35.9. And this year we managed to hit 40 degrees plus. And I found this statement from the Met Office Chief of Science and Technology quite sobering when he said, and when he was reflecting on us breaching that 40% degree, he said it wasn't anything that he was expecting to see in his career. So having said that, we need we need solutions. We need strategies on how to adapt and to mitigate, and we need them. We needed them yesterday. So on this slide, I summarize some of the key messages that came out from these two reviews. So there are two recent reviews of implemented actions on heat adaptation. And the first thing that they said is that we need more evidence on cooling strategies. So we need to understand what works and how it works and where they can be best implemented. The second thing is that they completely ruled out air conditioning, and this is because it is costly, it's unsustainable, so we end up emitting more carbon into the atmosphere by using air conditioning. But also it leaves out a huge chunk of population who can't afford to use air conditioning to cool down. The other thing that these two reviews said is that blue and green spaces are among some of the actions that can help societies adapt, and I'll be talking a little bit about that. And the last thing is that heat is considered largely a health issue in high-income countries, as Anna highlighted in her talk. But mostly in low and middle-income settings, it's considered an economic and social economic impact. And I'll be touching a little bit on this. So there's a little bit of mismatch on how we view heat, depending on the settings. So one of those reviews came up with some really great cooling strategies, ranging from landscape strategies on the left-hand side to the things that we can do at a building level. So how we construct our buildings and what we can do to enhance cooling, to strategies that we can use at the individual scale. So you can see things like using electric fans, immersing feet in water, using ice towels, etc. And on the left-hand side, on the landscape solutions, you can see that things that deal with vegetation, for example, grass and plants and trees feature quite prominently. I'll come back to those. But before I come back to this, I just want to give a bit of a profile of the type of agricultural workers that we are talking about and I'll give the example of central Tanzania in Dodoma, where we've conducted some studies. So for that particular population, and indeed across Tanzania, agriculture contributes to something like a third of the GDP. So it's a huge income earner. And nearly 80% of all households in that country engage in some sort of farming. And a fraction of that 80%, about 16 million people engage in agricultural activities. And this is a primary source of income. So we call this group dedicated farmers, yeah? And amongst those dedicated farmers, the annual per month income from agricultural activity is minuscule. It's about 18 to 48 pounds a month. So it's not a lot. And for this cohort, there's a lot of illiteracy. So between 14 and 23% have no formal education, so meaning they can't read or write. And this particular setting, as is most sub-Saharan African setting, it's very hot and dry. So it's a semi-arid climate, and it's hot or warm across the year. So it's very similar to the landscape that Anna was showing us in the Gambia. There's very low rainfall, so there's water scarcity across the year. And farm labor is not intensified as it is in a lot of Western countries. So there's a lot of manual labor and very little use of machinery or sophisticated equipment. So that's the background. So if you go back to some of those cooling strategies that were suggested on that review, we can rule out most of them really for that particular population. So they won't have electricity, for example. We can rule out some of the strategies that deal with maybe sophisticated equipment. Some of the ones that could really apply for that population are related to how we use landscape, and indeed how we use the natural existing landscapes, so grass, plants, trees, and also shading infrastructures as an example. On the individual scale, it's possible that that population could work by maybe wearing less clothing, for example. I've highlighted cold water ingestion. So that's just hydration, I guess, drinking water. I've highlighted that in orange to say that it is an option, but it's always a costly one because, like I said in the previous slide, there's a lot of water scarcity in that region. And likewise, reducing activity is not really an option when this is a primary earner or primary source of income. So they have very few options or very limited options. Okay, so I want to introduce this concept of nature-based solutions, which are solutions that work with nature, so work by enhancing the natural environment to deliver multiple benefits. And they work across multiple habitats as shown on that image, so ranging from forest all the way to farmlands, cities, and coast. I've put a circle around farmlands because the kind of solutions I'll be talking about today are implemented in agricultural landscapes. And the other really attractive things about nature-based solutions is that they are very low cost. And increasingly, they are seen as a way of helping us achieve global sustainable development goals. And I'll be giving an example from some of our work in Dodoma. But this idea of using the natural environment or nature-based solution is really not new. And this is an example of an existing framework, which is a Millennium Ecosystem Assessment Framework that's been around for close to a decade now. And it's a way of linking ecosystem services. So that these are services that we receive free from nature, and we can attribute some of those to human health benefits. So the blue arrow there points to an example of how the natural environment can deliver cooler temperatures, cooler outdoor temperatures. And this is an example of how we use some of those naturally existing habitats to cool. So the image there is showing people dipping their feet in water, and the one on the right is people sitting outside a shade. So these are things that they're not new concepts to us. We do them perhaps even without thinking about it. Okay, so just to talk a little bit about the work that we did in Dodoma. So we wanted to understand what are the pathways from ecological restoration, so restoring degraded natural habitats, and how that impacts on health outcomes. And we're interested in a specific intervention that is farmer-led. It's called farmer-managed natural regeneration. So working with farmers to restore some of the landscape that have been primarily degraded due to poor agricultural practices. And it's an effective way of restoring those drylands, as I'll show you in a minute, but also a really good way of promoting climate resilience. It's very low cost, and in fact, it doesn't require any transplanting or watering, and farmers are just encouraged to work with natural occurring vegetation or tree stumps in the environment, pruning them periodically and waiting for them to grow into fully grown trees. So we conducted focus groups in that region across 4 villages with about 7 to 8 participants per group. And we wanted to evaluate from the farmers' perspectives, how do they link those changes in ecosystem services to human health benefits? And this is a diagram just to demonstrate. It's actually a real image on the left-hand side, a real image of a landscape that has been restored. On top, you can see what the landscape looked before practicing FMNR. And the bottom, you can see what happened after a few years of practicing FMNR. And on the right-hand side, I just wanted to kind of bring that a little bit to life to kind of show how the outdoor working environments would have changed dramatically from that very barren, dry landscape to something that's more similar to what we see when we practice FMNR, and this idea of incorporating trees into agricultural landscape. You can see that woman doing that. So one of the things that trees will provide here is shading, which has human health benefits, but also benefits in terms of better yields or crop production. This is a busy slide, but it summarizes the content of the focus group discussions with the locals. What I've tried to do here is to map them against or alongside the Millennium Ecosystem Framework. So provisioning services, supporting services, cultural services, and regulating services. The green boxes show how the locals translated the benefits of having trees into ecosystem outcomes. So things like there was a little bit more increase in biodiversity, for example. There was a reduction in soil erosion. You can see in the middle part of the diagram there. But what I wanted to highlight is on the bottom right-hand side is trees were increasingly providing shading, and they repeatedly told us that. And they were able to link that into human health benefits. So for example, they told us as a result of improved thermal comfort during working outdoors, there was less dehydration, for example, but also there was a lower heat risk, which resulted to reduced hospitalization. So I'll try and hone down a little bit on the thermal comfort and the shading thing by using quotes from the farmers. So the first bit here links that thermal comfort to the improved agricultural practices. So they were able to reflect back to what was happening 2 to 3 years before, when they were working in a very barren landscape, and they're saying as a result of that bad agricultural practices where we used to cut down trees, there was no shading and there was nowhere for us to rest. Repeatedly, we had farmers telling us that it was very hot. But nowadays, because of increasing shade, people can work under a tree to avoid the heat. There was also, they linked the improved shading to improved working condition, particularly during working outside. So you can see here people saying that you will find people sitting under a shade, for example, when they're processing or preparing seeds in the growing season. There was also linking that to what I'd call, I guess, microclimate, by saying as a result of the shade, you can now experience a bit of a breeze around the farm area. There was a lot of comparison between villages that were practicing and villages that did not practice. So, and I think it was a very visible impact of how the environment was altered between different villages. So this person here is comparing their village with a neighboring village that does not practice FMNR, and can say you feel a bit of a breeze because of the trees. But I think what really fascinated me in particular was how they were able to link that not just to heat, but also maybe to other outcomes. For example, there's a reduction in dust. The first person there talks about how trees help them cope in the heat, but also it gave them cleaner air. And the bottom part there, they talk about having a bit more cleaner air. And as a result, there was less dehydration and less trips to hospitals. So that was quite powerful, I thought. So the other thing that trees were able to do very well was their ability to increase availability to water. I guess not just the availability, but also the accessibility. So here people talk about that availability being increased because trees led to a bit more rainfall. So, and the other thing they talked about was that trees help retain water in the soil. So this idea of trees helping groundwater catchment was very real and very much experienced. And the other thing they talked about was increased accessibility to water. So this one woman told us about how she needed to travel to the mountain, which was kilometers away, to fetch water, but because of the return of rivers and boreholes filling up, she was now able to fetch water much closer. On the top left-hand side was a really powerful account from a gentleman who told us that something that really surprised him was that the rivers were filling up again. So there was a return of water in the small streams, so the small rivers in the area. And that was evident not just in the rainy season, but throughout the year, including dry seasons. And again, it wasn't just the benefit on the heat impact, but some of those benefits also cascaded to to health benefits. So for example, there was more increase in water that was available for farming, which led to a little bit higher yields in terms of crop production. And the bottom part on the right-hand side, one woman was telling us about how the increase in water led to decrease in diseases such as cholera because they had cleaner drinking water, for example. This is a study that was done in the area a few years ago, and just to confirm what the locals were telling us in terms of the change in the microclimate, this was a quantitative analysis of the impact of increase in tree cover, and you can see that they found that a reduction in land surface temperature of about 1.32 degrees, which was significant between the areas with higher and versus areas with lower tree cover, and this was done in the dry season. Unfortunately, studies like these, as I've increasingly finding, don't evaluate what this means for health. So it's very difficult to translate this to real health outcomes. Similar studies have also shown how increased in shading can help alleviate workers, outdoors agricultural workers from heat stress. And this is a work that was done in Latin America, looking at shading infrastructure. So you can see people resting under a shade there. And this was seemed to have reduced heat stress for those workers. But if you compare that with working with the natural environment, I think you can kind of see what the benefits are, because working with trees in particular has multiple added benefits beyond shading, like I showed in my earlier slides. It's also low cost. You don't have to buy anything, and it's sustainable, but also it has benefits on climate adaptation and mitigation. But also I think the thing to highlight is that there are some unintended consequences, and we have to be careful with any sort of climate change mitigation and adaptation solutions. Some of the negative effects of solutions such as FMNR is that if it's poorly implemented, it can lead to crops competing for sunlight with the trees, which can lower crop productivities. But that can be overcome by having a good ratio between the tree cover and crop cover, for example. Some of the other unintended consequences might be related to increase in vector-borne diseases, such as malaria. Okay, so this is my last slide, and I'll conclude there, maybe by just reminding everybody that the UN has declared the next few years up to 2030 as a decade for ecosystem restoration. And as we speak, there is literally thousands of restoration activities and potential solutions taking place globally. In a lot of those solutions, the health voice is missing. And yet, as communities in Tanzania who are restoring those landscapes in Dodoma told us, the health was a big driver for ecosystem restoration. And in fact, they told us that it was only when they saw those tangible benefits, economic, but also health benefits of restoration that they made a commitment to continue restoring the natural environment. So I'll just end by arguing that a health perspective is very much needed in ensuring implementation, in particular balances the benefits and the disbenefits and maximizes the best possible outcomes while avoiding harmful effects. So I'll stop there, but I'm happy to take any questions. Thank you.
Thanks very much. Any questions in the room? Okay.
Yeah, I was just curious to know if there's any evidence around what the sort of critical mass of tree planting would be to create any meaningful impact on temperature or health outcomes.
Sorry, could you repeat the question again?
Whether or not there's you have any evidence around the sort of number of trees that would need to be planted to have any sort of positive health outcome impact?
So you're talking
It's a really difficult question because, like I said, there seems to be a disjoint between what environmental scientists are doing versus what health professionals are doing, and it's an area that we are trying to get involved in increasingly. So a lot of the studies that, for example, the one I showed, they'll measure the impact on microclimates. For example, they say the temperatures went down or reduced dramatically, but they won't really measure the impact on health. So they think there's a huge gap, and it's something that we're hoping to address. But in terms of how many trees would be required to see, for example, economic benefits at a farm level. So typically some of those farms in Dodoma were about between 1.5 to 9 acres. So that's just an example. And they say about maybe 50 to 60 trees for that amount of farms. So quite a lot of trees, but probably maybe not enough. Because like I said, there are also unintended consequences. So you don't want too many trees in your landscape, and that will compete with the crops, but you just want that optimal sweet number, which is around 50 per acre or so.
Thanks. Any other questions in the room? I think there's one online. There's 3 online. Oh. Okay, let's have a look.
Maybe I can answer the last one there. Are trees bought in or planted, or are they just wild trees left to grow where they are?
Yeah.
Yeah, okay. So that's a really good question. So unlike some of the agroforestry interventions that you see across sub-Saharan Africa, but also in Asia, FMNR works by regenerating native trees. So they don't plant anything, they're not seedlings, and nothing is watered. So they are native trees, and which has better outcomes, I think, because those trees are built, so to speak, for those landscapes. So it increases their chance for survival because they're not exotic or new species. And actually, there were some accounts from the locals telling us that they were excited when those native trees came back, because some of the species that had they deemed extinct, for example, they kept talking about wild mangoes that had gone extinct, and now they were able to enjoy those fruits again. So yeah, so they're all native trees. It's a quick answer.
So you could also answer the second question about how, what's the time frame of these sorts of interventions?
Yeah. Okay. So with FMNR, and I think that also kind of, yeah, maybe just to emphasize the benefit and why people find it so attractive, they were able to see changes in the landscape within 2 years of intervention. And every time I say that, people say, oh my God, that's really quick. And this is because, like I said, they didn't plant any trees. So they're working with tree stumps that were already in the landscape. And if you think of a tree stump, underneath that tree stump, there's an extensive system of root systems, for example. So those trees are not growing from scratch, and that's why they're able to grow so quickly if left untouched or if protected. So I'd say within 2 years, they were able to see some of those ecosystem services, and maybe within 3 years, they were able to see some of the social economic benefits. For example, they could harvest those trees for timber or for fuel or a return of the fruits, for example.
All right, any other questions? Otherwise we can move towards a more kind of general discussion, because the top questions are very
Should I mention?
yeah, so the top questions are around how you protect outdoor workers. So
yeah, sorry. There's a group that have been working in the EU called the Heat Shield Project, which have particularly looked at construction as an at-risk group, and they've worked across Southern Europe and Qatar, and have come up with multiple interventions that have been effective at reducing the heat stress in different industries. So they looked at construction, agriculture, tourism, and travel, I think. So yeah, it would, if you look up Heat Shield EU, you'll find some nice studies around that, different ways of mitigating against the heat.
the issue there is also about governance. So there are rules already for protecting workers, but if those rules aren't enforced, then the workers are not protected. Particularly, and there's the informal sector, of course, which are not protected either. Any other general questions? So I had just a question for Penny about there were a lot of benefits kind of related to rainfall and water supply. How do you know that that is, how is that due to the tree planting? What evidence do you have that that's due to the intervention?
Yeah, so we've only done focus groups, so it's very subjective and we're just relying on what the farmers are telling us. So one of the questions we ask them is, if you think of before you started the intervention versus after the intervention, what do you think those benefits are? But I take your point, Shari. I think the next steps to this work is trying to triangulate these quantitative studies with more quantitative studies. And it's something that we are working on at the moment, dependent on funding really, but it's something that we'd like to take forward. But I think it needs to be done quantitatively to confirm or to link it back to the trees.
Okay, any
Yeah,
comments?
thank you, Penny. I would like to ask if there were any incentives for these people to wait 2 to 3 years to do what they were doing. Some of them may not have had their own land, but also I think there is some other support that could have been given to them, either from organizations or something, and that might be worth knowing. Thank you.
Yeah, so one of the things I forgot to mention, but it was on the logo there, I was working with two environmental conservation groups. One of them is homegrown. It's actually, it was started by a local bishop in Dodoma, and it's called Lead Foundation. So they've established really good links and networks and communication with the local. So it's a very much well-trusted group. And the other one is a bit more global. It's called Just Dig It. And in terms of the support that the farmers were given, there were no incentives. So they weren't given any cash payments, for example, but they were just offered training. So they were offered training how to prune the trees, how to put a mark on the trees so to protect the trees from, for example, from livestock. And the other thing I guess they were given in terms of support was, so those two local groups worked with what we call champion farmers. So they would train these local farmers who are typically local leaders in the villages, and then those local farmers would then train other farmers. So it's very much a grassroots system. But in terms of why we think it spreads so much, so in the Dodoma region, which is just slightly bigger than Greater London, yeah, so they've managed to restore 9+ million trees in the space of 3 years, which is a huge thing. But we think it's because of using those local channels and working with people who have trust relationship with their communities, but also because they are able to witness before and after from the neighboring villages, for example.
I mean, I think that's a really important question, is about what sort of evidence do you need for these sorts of interventions? And what evidence do you need for the communities to change their behaviour? So perhaps Penny and Anna could comment a bit more, because do we actually need epidemiological studies? Because heat is a rare outcome, and heat stress or a heat-related death is an extremely rare outcome, and you'd never be able to do some kind of trial that would have that as an outcome. So you'd have to use some kind of proxy outcomes. It's actually quite hard to demonstrate it in terms. So perhaps Penny and Anna, you could say about what do you think would be the ideal evidence to kind of move forward with those two studies? Anna, you can go first.
Thanks, sorry. So just so that I understand your what evidence is, what do we need to do to start implementing some of these things
for that community?
For that community, yes. I think as someone who's sort of come into a different culture, I was very aware that I have my own, I'm coming with all of my own ideas, and that when you arrive and you start working with people, that actually there's no point in coming with your ideas. You really need to come open and see what's happening and allow a production of effective solutions to come forward. So I think any solution that is going to be sustainable and enactable has to be driven by the people who are on the ground, because they know their situation and they really understand what they need. And I think sort of Penny's work really highlights that, because it was so successful because of that. Yeah, so I'm a great advocate of co-production, basically, going forward.
I just have to echo that, and Anna, it's. I was surprised by how much knowledge those local communities had. I think I talked in one of my slides that there is a huge low literacy rate that, you know, quite low, you know, if you compare maybe to the UK, but yet for people who can't read and write, the understanding of how ecosystem services linked to health benefits really fascinated me, you know, beyond what I knew myself. I was learning so much from them, and I think there's so much we can learn from them, and so much we can tap into and really begin to understand those connectivities. So that would say things like the trees improved the moisture content in the air, you know, and I think so maybe they're talking about humidity. So we have our own scientific understanding, but then they had their own local understanding, and those two things are exactly the same thing, but just different terms.
Right, just quickly, we have an additional question about was deforestation, so using trees for fuel, an issue here, and if so, how do you, what could be done to stop it, I guess?
Yeah, so it was deforestation and also just cutting down trees for agricultural production that led to the landscape being degraded in the first place. But I think, but yeah, so I mean, they still need firewood. I mean, it's fascinating, Anna, that you're talking about your follow-up project using cook stoves. So they still need firewood to cook, and a lot of cooking uses firewood. But part of the training is to teach them what part of the trees they need to cut down. So you don't need to cut down the whole tree to harvest firewood, but you can prune the trees and use the branches for firewood, for example. So it's sustainable management of the landscape is what they've been taught.
Somebody raised their hand. Can they ask a question? I can't see from here. Someone's got them.
It's lowered. They lowered it again, so maybe it's by accident.
Okay, all right. We can accept questions. Okay, any questions from the room on those, particularly around evidence? There's a kind of demand for evidence, but public health people can be quite conservative in their approach to evidence, let us say, and that can be counterproductive for these sorts of new things. But they also, public health people, generalizing horribly here, also fail to engage with environmental scientists in a useful fashion. So that is on us as public health scientists. There is a lot we can do to engage more. So I'm going to put that back to Penny and Anna again. What could public health people do more to work with other sectors, to work on environment or heat issues? I'll let Penny go first with that one.
Yeah, it's been a huge it's been difficult, but I like you said, Shari, I think sometimes I find the hindrance is really from the public health practitioners rather than from the environmental scientists. Quite often I'd go to meetings and I'll be the only public health person, and when I speak to my environmental scientists, it's the same. They go to a meeting and they'll be the only environmental scientist in the room. So yeah, so there's a clear need of working together. I think it's going to take slow steps, but I also feel like fundamentally it just needs to be better funded and better resourced. So maybe this is a question for funders, you know, are they willing to fund projects that are multidisciplinary in nature? Because I think that's a way of accelerating it. But I feel like some of the current funding mechanism only want to fund one or the other and not both. Speaking from personal experience.
Yes.
Yes. Okay. Anna, did you want to add something?
Just also speaking from personal experience, I would agree with Penny completely that it's really nice to build a team, a transdisciplinary team with a great idea that brings in lots of different perspectives and very different perspectives like ecologists and environment and health, and then you don't get funded. It's extremely frustrating. So I would say there's willingness to happen, yet to come in.
Yes.
Yeah, just on the engagement like part, I am from Iraq, and like for us, like the heat wave or like the extreme heat is like means from June to September, like the average temperature is like between 40 and 50. In some cities, like it goes above 50 as well. But it's interesting, like like even in Iraq, I don't see even that discussions. Like I haven't seen any collaboration between like the institution like LIDC or like LSTHM with the universities or even with the groups in Iraq. Like Iraq as an example, but like it's great to see that initiatives, but like collectively how that can even happen. I know like you talked about the terms of fund and that things, but still like maybe some collaboration can happen with the other countries, because like we cannot wait for all the countries year by year, because I do see it's a global challenge. So how do you see that?
There's a lot of scope maybe within the climate change space now, because countries develop their own adaptation plans, and a lot of those have interdisciplinary working groups. Although we know from sort of doing a lot of interviews, it's still really hard to get the health people to come to that table. But those sort of cross-sector working groups or expert panels often are the main place where people interact. And there's also kind of a lot of separate initiatives of getting people to work, health systems to work with the Met Office. And there's a lot of effort being put in to get Met services to have health people and talk to health people. Like Penny and Anna want to add, there are kind of mechanisms, but you're right.
I think, yeah, I think we saw from COVID that there's often a sort of exceptionalism mindset around sort of collaboration across countries, and maybe that's also true in the climate crisis, and maybe it's just on individuals to break through that and be open to the idea of working across different nationalities and in different settings.
Penny, did you want to add? Can you just scroll?
I'm not sure I got the question, so but I think you've probably answered sufficiently.
What kind of mechanisms are there to get the health professions to work with other sectors?
Yeah, I think I feel like some of the work that we've done within the NIHR, and Shar, you were the previous director on that. I think we worked very well with the Met Office. So maybe it's how do we learn from those collaboration in building collaborations elsewhere. But I also feel like sometimes we are pushed to do that when we're faced with tragedy. So for example, COP, now climate change, is how do we do that before the tragedy hits? And yeah, I don't know. We keep trying is what I'd say.
Okay, you should get Iraq to do a heat health action plan. That would help. they might be. They're all interdisciplinary, yes.
It's kind of a contribution, kind of a question, but I'm really glad you said that, because you said Iraq and then I thought you said Iran, and I was thinking that's not a very Iranian accent. My other half is Iranian, and as anyone knows, environmental campaigners are not beloved by the Iranian government. So I wanted to ask a question about people who aren't like necessarily academics and so on, but who face penalties for trying to do things to protect the environment, as is the case in Iran and Brazil and so many other places. And you know, what can I mean, there's a question there kind of related about how can charities and NGOs best contribute to this space, but I wanted to link that with with what you said today. Does that make sense? I think I've got so many thoughts going off in my head now. I'm trying to come out with something lucid. So yeah.
Maybe I can try that answer a bit, or maybe contribute a little bit to that. I think charities and non-academics are really at the forefront of this. You know, they're probably doing even much more that we can never do. So I talked about the 2 charities I work with in terms of ecological restoration, but there are many others who are doing a lot. It's really how do we combine efforts. The way I kind of see my research really taking shape is trying to contribute to the evidence gap. So they always tell me, those 2 charities I work with, that one of the biggest challenge they have is bringing in money from philanthropists because they can't demonstrate the impact. And so maybe that's where, as an academic, we can help in demonstrating that impact, which will then help them continue with the wonderful work that they do.
Yeah. Any other thoughts? Yes, thank you.
Right, thank you. So I just wondered, do you think public health practitioners and academics have a role in sort of lobbying government and making changes happen, such as, for example, reducing the need for political vehicles? I don't know, such as via the research policy cycle that really happens via like, the climate change committee. So do you have a role in that space?
Yes. So there is under the Climate Change Act in the UK, there is a science policy cycle. We've just done the UK risk assessment. So I contributed to the evidence report for that. And the National Adaptation Programme is based on that and is being drafted at this very moment. But I think there's a wider question about advocacy. And so public health people do a lot of advocacy, and there is a huge amount of climate change advocacy. Like there's this fossil fuel anti-proliferation treaty that just went round. So and the same goes for reproductive rights and smoking and the commercial determinants of health, alcohol and food. So I'm happy. I can live with public health activism and they're up to a point, I guess. I don't know what the panelists think. But the other thing I just wanted to say is there's going to be increasingly legal actions, and that's something else that NGOs and charities do. So the government just got taken to court for not having a decent plan to meet net zero. And we can see, you could take the Iranian government to court, or the Iraqi government to court for not having a plan for dealing with heat deaths, for example, as it gets. So I think that's where a lot of this is going to go, maybe legal measures. Okay. Do you want to, do you have to wrap up now? That's a good comment to end on. Do you just want to say some final comments about the role of public health people in activism?
I almost want to ask Anna to say something about PHN because she was a previous network coordinator. So this is the student arm of the center that did a lot of activism. Over to you, Anna. Sorry to put you in the spotlight.
Yes, I don't have any conflicts. I think if you're a scientist working in this space and you feel passionately about it and want to protest or advocate for change, then absolutely that's your right to do so. And there's a lot of need for that at the moment, because as we were saying, we have a lot of the solutions here, but they are not being enacted. And so really it's understanding why they're not being put into place and pushing for that change, to see that change. And so yes, we, as part of the Planetary Health Network, we would organise events to increase awareness around planetary health issues, and absolutely, I think it's
so for any current students, please join the Planetary Health Network. That's great. All right, let's thank our panelists again. That was an excellent talk.
And sorry, before you go, I'd also like to thank you for brilliantly moderating that. And also, I know how busy you are, so the fact that you've made this time to come over here, and I certainly am leaving here a lot more hopeful than I was, when I was putting the chairs out, and I was thinking, oh, we're all doomed. We have reasons to be cheerful. Guys, stay connected with us, link up with us on Twitter, think about what you want to see LIDC doing, because we do respond to the needs of our members. So please stay in touch with us and big up yourselves and big up the people who joined us online. Thank you.
Thank you. Bye.
Bye-bye.
Bye-bye.
Shall we